Today we'll be going over the knee, in particular a condition called Pes Anserine Bursitis. And where that occurs is right down here on the inner side of the knee. So what happens is that these three muscles, sartorius, gracilis, and semitendinosus, get tight and they pinch on this bursa sac that's underneath them. The bursa is like a fluid-filled pillow that protects between the tendon and the bone that it attaches to. So that way it doesn't rub, but whenever that gets tight, it pinches down on that bursa sac and then it inflames, and it also causes like inflammation for the tendon as well. So ask me in the comment section how I know about this injury. The sartorius is a muscle that helps with knee and hip flexion, like when you're sitting or climbing. It abducts and laterally rotates the thigh. The gracilis, it'll adduct the hip, like bringing the hip inward, and it flexes and medially rotates the tibia at the knee. And the semitendinosus is a hamstring muscle that wraps around and comes up here, and then that muscle flexes the knee, means bends it, and it immediately rotates the tibia on the femur when it's in a flexed position. And it also medially rotates the femur when the hip is extended. It also counteracts forward bending at the hips. On this right knee, you can see this MCL and then the medial meniscus. When you have that sartorius, semitendinosus, and gracilis muscle that attaches nearby, if you get pain in that region, the knee will start kind of flaring up and you might think that you have a medial meniscus injury or an MCL strain of some sorts. So we just kind of want to do a differential diagnosis for this whole area and kind of treat it as if there's possible injury if you feel medial knee pain. So now we're done with the anatomy. Let's move on to some exercises that could help. So the first exercise we're going to do is called a butterfly stretch. That's going to help stretch the inner part of the thigh that gets tight. Those adductors, the gracilis, you'll be able to stretch those muscles. And I suggest doing this for at least a minute. Sometimes I go for 2 minutes on this one. So now that we've kind of stretched the adductor muscle, we're going to do some pressure point release, some stretching with the foam roller. So I suggest getting something that's kind of soft, like the ones with the PVC might be a little bit too rough for you. But what I want to do is bring your inner thigh over this foam, and you want to kind of run back and forth on it using your opposite leg. So for me, it's my right leg that I'm kind of bracing and allowing less or more tension. And then I'm rolling the inner thigh and then also the front for the quad as well. That's good to hit. And I'll probably run it back and forth about 10 or 12 times and kind of run all the way up the thigh on the inner part. And then what I also do is do like a quad stretch, bend that knee, and then also run that foam right on top of that quad, and then turn it medially and run that edge there. And that's going to help reduce some of that spasming, because the adductors, the quad, the hamstrings, they're all fighting, they're all angry. So it's really nice to release them with this. This is a really big tool that will help. Another nice mobilization that I like to do for the knee is a knee gapping osteoarthritis technique, where you place a small towel roll underneath that knee, deep as you can. And then what you do is you brace, and then you slowly bend the knee. And what that's gonna do is gonna separate that tibia down here from the femur up top. So it's gonna gap open the knee, increasing a little bit of pressure, because if there's swelling inside there and grinding, it causes more inflammation. So this is a nice tool to help gap open that knee. And before I started recording, I had a pop in my knee, so you'll know that maybe there might be a pop in there, but that's that's okay because we're just releasing some of that tension in through the knee. And whenever you gap a joint, there's air bubbles that expand, like little gas bubbles. And that's what that popping sound is. Even the same thing when you pop your knuckles. So on this one, you want to do about 5 reps, holding it for about 5 seconds, and then come off of it. So the area of concern right in through here is that Pes Anserine region, where the 3 muscles lay on top of each other and they insert into that medial part of the tibia. Whenever you have pain in that region, it's also nice sometimes to place a cold pack for about 5 to 10 minutes. And you can do this about 2 or 3 times a day. I wouldn't overdo it. Whenever you overdo it, you start to get kind of a stinging and burning sensation in the skin, and it almost like kind of makes it worse. And you'll notice that the knee will get a little bit more puffy and just irritated. So I have to kind of back off on how much I ice it. So, 2 to 3 times a day should be okay for the first week or so, or until the inflammation is subsided, as we do these stretches to help stretch that region. The next stretch I would like to do is something for the hamstring. So I'll bring my leg up, bend forward, brace onto something, and then lean forward, and you'll feel this stretch in the back of your hamstring here. And then from there, I'll kind of bring it in and make it more biased for the adductor and hamstring. So we're kind of getting a 2-for-1. Bring it back, a little bit more rotation. And we got sartorius kicking in too. And then just bending the knee, coming away, 30 seconds, let it release. All those muscles feel great being stretched. I can attest to this because I've been running, and I just started about a month and a half ago, and it also mentions that you can get these type of injuries from overuse, repetitive injury, obesity, trauma, and stress to that tendon.
This exercise is called a prone quad stretch with strap. You want to hold this stretch for 30 seconds to a minute. If you don't feel enough stretch, I'm going to go ahead and show you another variation that'll help you with this. You'll also notice that there's an arch in my low back. If this is too painful for you, or you have limited extension in your lumbar spine, I'm going to go ahead and show you another variation for that as well. And then the last one we're going to do is in standing. So this is the variation I mentioned earlier. If you're not feeling a stretch in your quad, you may want to put a pillow or something underneath your knee, which is going to bring you more into hip extension. That's going to stretch your quad better. This third variation is one that's going to help if you have low back pain or if you can't get into extension of the lumbar spine. So this kind of reverses that curvature, puts a little bit of slack onto it. You notice how my arch is less in my low back, and also what you want to do is lay down further instead of coming up, because that's going to put your back in extension. So lay down further so that way it kind of rounds your back out a little bit, and you want to hold that stretch for 30 seconds to a minute.
So this is the final variation of a quad stretch that we'll be going over today. This is just a standing quad stretch. What I like to do is make sure that your hip and knee are neutral. Then if you don't feel the stretch, what you want to do is, just like earlier when we put the pillow underneath the knee, what you want to do is bring your hip back, and then I'll get more of a stretch. Another variation to that is if you want to get some of those adductor muscles, since that's the area that's kind of like tight. What I like to do is kind of do a quad stretch, but then like maybe bring out my knee slightly to the side, and I can feel some of those inner fibers working, but only just briefly for like 5 seconds or so. It's nothing like we're going to prolong stretch for 30 seconds to a minute, just like that, but just kind of adjusting little micro adjustments to it. But you want to hold it for 30 seconds to a minute and repeat it for at least 2 sets. All right, so we finally have a name for our skeletal model. His name is Vesalius. This is from Andreas Vesalius, who was a physician and anatomist in 1514, and he passed away in 1564. So he lived to about 50 years old. And the reason why he's important is he's known as the founder of modern anatomy. Whenever he was around, he was not able to get any bodies for his dissection and study. So what he did was go to the local prisons and he would actually do grave robbing and dig up old inmates that had passed away over there. So that's like the kind of pick that he had for the bodies. He wasn't able to get any grants from universities, or he wasn't able to get any cadavers. So what he did was did some grave robbing of prisons, and would put them on his dinner table and just dissect them and find out the truths about different part of our anatomy. So he was able to correct over 200 different anatomy tissues and structures in our body. One in particular is that in the past, we used to think that we had two jaws like a dog, like a canine, two-piece. So he found out that we just have one jaw for humans. So that was like one cool thing that he found out. But he's a founder of modern anatomy. So Andreas Vesalius, welcome to the team. And thank you guys again for tuning in. Stay tuned. We're going to continue looking at different anatomy and different diagnosis. Leave a comment section below what you want to see. I'm open to suggestions. We're going to be on this long road together. So let me know if there's something that bothers you and you're in pain in a certain part of your body, and I'll make a video on it. Let's go. So thanks again from the mechanic shop, and we'll see you next time. So stay tuned and get strong with the mechanic shop.